Here in the United States, we pay the world's highest prices for our prescription drugs. With 4% of the population, we spend 40% of the total money that's spent on prescription drugs. I see 5 basic reasons for this, and all of them can be fixed. 1, too much influence from marketing by the pharmaceutical companies. Many books have been written on the theme that Americans just take too many drugs overall. And these are the perfectly legal prescription drugs. We're not even counting the illegal drugs. The books I'm showing you are just a sample. Both patients and doctors have a distorted view of how much medicine is really a good idea. Dr. Jerry Avorn of Harvard Medical School started a special division to help doctors prescribe medicine more appropriately. He also wrote 2 books for the public. He told us doctors are not always giving us the best treatment because the number of drugs available and the information about them is overwhelming for the average doctor. Dr. Avorn and his colleagues are working to fix that part. 2, the public gets no credit for the investment we have all made in drug research and development. Our taxes fund billions of dollars worth of the initial research steps, where scientists learn the mechanism of diseases and find possible chemical targets. This is the hardest, highest risk part of drug development and usually occurs in academic settings. Private charitable organizations also contribute billions of dollars. No doubt you've had someone ask you to contribute to donate money for research on specific diseases, such as breast cancer or Parkinson's disease. However, once a pharmaceutical company takes on further development of a drug that started with academic research, the pharmaceutical company gets all the patent rights. So in practical terms, all of us subsidize the pharmaceutical companies in their development efforts. So they have more money to spend on marketing, for example. Now, we could regulate pharmaceutical marketing. One way would be to ban marketing to the public, or at least we could reject those marketing expenses as tax deductions. As long as drug prices are high enough to pay for massive marketing campaigns, at least the pharmaceutical companies could pay a few taxes on that money. 3, the United States has no regulation on drug prices. We're the only developed country to let the pharmaceutical companies charge whatever they want, even after we paid for a large part of the research that they depend on, and we give them exclusive patent rights as long as the drug is under patent protection. This can be fixed easily. We can start regulating drug prices according to how much benefit the drugs offer, as every other developed country does. And even better, we could regulate the price based on the benefits plus how much of the development costs were actually paid for by the pharmaceutical company as opposed to the federal government or the philanthropy organizations or somebody else. 4, then there's patent manipulation. 80% of our prescriptions are for generic drugs, but 80% of our spending is for brand name drugs, many of which are still under patent protection. Pharmaceutical companies have found some very creative ways to get multiple patents on the same drug. Dr. Avorn tells us that each of America's 10 top-selling drugs is protected by an average of 74 patents each. I don't know how they get that many patents, but here's one example. Prilosec and Nexium are almost identical. There's just a minor change from one to the other. But when the patent ran out on Prilosec, then all of a sudden Nexium came along. Now, is it different enough that it should have a new patent? Well, I certainly don't think so, because you can still buy both of them for the same price in just about any drugstore. And you can try it yourself if you have heartburn. That's what these are for. They are over the counter. Patent manipulation is another way to spend a ton of money without producing any benefits to sick people. And this can be fixed fairly easily with an upgrade to the patent office. 5. Astronomical pay for executives. This is the same problem most American companies have, so it's not easily fixed. But I'll show you the numbers because they do contribute to high drug prices. I grew up in the post-war boom era, when it seemed obvious that the United States was the best at everything. Now, not quite so much. But we can fix the areas where we're falling behind, including affordable health care. We just need to get on with it, and drug prices look to me like a great place to start.